Hi, my name is Simran, and I'm doing my presentation on the flu. So the flu is a common name for influenza, which is a very contagious respiratory illness, and it's caused by the influenza viruses. It can cause mild to severe symptoms. Sometimes the flu can even result in hospitalization or death, although that is very rare and usually happens in immunocompromised patients, such as people that are severely sick, or infants, or the elderly. So, influenza is an acute illness of the respiratory tract, like I mentioned previously. Some of the main signs and symptoms of the flu include a fever, headache, muscle ache, runny nose, cough, and a sore throat. Some other symptoms are also a stuffy nose, feeling tired, diarrhea, and even vomiting. So, the pathogen that causes the flu are the different viral strains of influenza. There are three types of influenza viruses, which are the A, B, and C viruses. Type A is the most common, and it has two other subtypes, which are the H1N1 and H3N2, which are, like I said, the subtypes of influenza A. The influenza viruses possess two known virulence mechanisms that are responsible for having to periodically update the vaccine. And this is the virulence factors that I'm going into. So the first mechanism involves both influenza A and B types. It is called the antigenic drift, which is when the virus introduces small changes very slowly but continually to become a new strain so that the existing antibodies cannot be recognized. And so the second virulence factor involves only influenza A, the A type, and this is the one that also infects humans the most. So the antigenic shift does not occur all the time, but when it does in the influenza A type, it is abrupt and produces a new subtype virus complete with new surface enzymes, which are usually new hemagglutinin or neuraminidase, thus leaving people without vaccines, which were already induced with antibody protection. So hemagglutinin is a glycoprotein found on the surface of influenza viruses. This is what it looks like, and I have a picture of it. Here it is. I'll get a little bit closer. All right. And then neuraminidase is an enzyme that attaches to cell receptors and initiates the process of virus entry into cells. And this is what it looks like. I also have another picture of it on my phone. Here it is. All right. So the pathogenesis of the influenza viruses. So when the flu virus is introduced to the respiratory tract, usually by the contact of an infected person's saliva or other respiratory fluids, it attaches to and also replicates in epithelial cells. The virus replicates in cells of both the upper and lower respiratory tract. So the viral replication, which is then combined with the immune response to infection, leads to a loss of cells which line the respiratory tract. However, as the infection subsides, sorry, the epithelium is then regenerated, but this process can take up to a whole month. So the epidemiology of influenza is, like I said, the flu is a very highly contagious and infectious viral disease, which has pandemic and epidemic capabilities. a majority of human infections are caused by either type A or type B influenza viruses. As I previously mentioned, type A has been associated with widespread epidemics and pandemics, while type B has been implicated in regional epidemics usually. Also, the type C infections only cause a mild respiratory symptom or illness. So the yearly influenza epidemics affect all people or populations, but children younger than 2 years old or adults older than 65, as well as chronic medical conditions or weakened immune systems, are at the highest risk for complications. Like I said at the beginning of my presentation, so immunocompromised people are at more of a risk to contracting the flu. So the annual attack rate is estimated at 5 to 10% in adults and 20 to 30% in children. Also, the flu usually happens in temperate climates, and seasonal epidemics of the virus usually occur in the winter time. However, the tropical regions of the world may suffer from the flu throughout the year. The epidemics caused by the flu are estimated to result in about 3 to 5 million cases of severe symptoms every year and up to 500,000 deaths worldwide yearly. So the diagnosis, treatment, and prevention of the flu are: you can do a rapid flu test in your doctor's office, which is a nose swab, and then they put a little strip in a little tube where the swab was placed, and you can usually see a positive or negative for if you have type A or type B. Now, to detect any other flu types, you would need to do an upper respiratory culture, which would be another nose swab, but it would be sent to the lab to be tested further. So since the influenza virus is a virus, there are no antibiotics to treat it. Antibiotics just treat bacteria. So with the flu, usually you would treat the symptoms of it. So fluid for rehydration, NSAIDs or acetaminophen for fever, body aches, Zofran, which is anti-emesis and anti-nausea medicine, would be used if you have gastrointestinal symptoms. And to prevent the flu, you could either get the yearly flu vaccine in the form of an injection or a nasal spray. Please note that I have attached my references list as a separate attachment to the Dropbox submission. Thank you very much.